perform essential newborn care. So the first step that I will do is to remove all jewelry I'm wearing, including watch, rings, and bracelets. After that, I will now put on my mask and my close cap, and then prepare the equipment needed in linear sequence. So first, we have the gloves, dry linen, bonnet, syringe, plastic clamp, instrument clamp, scissors, and TB basins. On the other sequence, we have the eye ointment, stethoscope, vitamin K, hepatitis B and BCG vaccines. Also, we have cotton balls, tape measure, and a thermometer. Then after that, I will now prepare a resuscitation area for the newborn care, which is we have here. Then after that, I will now check that all the equipment, if it is clean, functional, and within easy reach. And after that, I will now perform hand hygiene and don 2 pairs of gloves. And then, after applying our gloves, I will now place a dry and sterile linen on the abdomen of the mother in preparation in drying the baby. Then after that, I will now I'm now ready to deliver the baby using aseptic technique. So call out, it is 5 p.m. and it is a baby boy. So after that, I will now place the newborn on the draped abdomen of the mother. And then start drying 5 seconds after birth. Starting on the eyes and the face, the head, the trunk, the back, the arms, and also the legs of the baby. And I will do tactile stimulation by gently rubbing the back of the baby or the sole of the feet of the baby to stimulate the baby to cry. And after that, I will now check the breathing of the baby. And then I will assess the baby using the Apgar scoring tool within a minute after birth. Then, next is I will now promote the skin-to-skin contact between the child and the mother. So I will remove the wet cloth and then I will place the newborn on either on the abdomen or the chest of the mother in prone position. after that, I will now cover the baby using the dry cloth. And cover the baby. And then also I will get the bonnet, the baby, and cover the head. So after that, I will re-evaluate the newborn by using the Apgar scoring tool and assess by using the cephalocadwal mother. So after that, I will continue the skin-to-skin contact between the mother and the newborn. Then after that, I will now remove my soiled gloves before handling the umbilical cord. And put it on the brush bin. Then after that, I will now palpate the umbilical cord and feel until the pulsation stops. And then I will now put on the plastic clamp two cm above the cord base and lock. Then I will now use a forceps and clamp it 5 centimeters away from the cord space. And then I will now cut the umbilical cord using sterile technique. Then after that, I will now check the presence of umbilical veins, umbilical arteries, and bleeding near the base of the cord. I will now promote early breastfeeding. I will nudge. I will observe feeding cues and nudge the baby to initiate feeding. And then after that, I will advise the mother and on proper position and attachment of the baby while breastfeeding. So we're now going to move the baby to the Crezhanne warmer. And we will now administer kids prophylaxis. So I'm going to open the eyes of the newborn by holding up the upper eyelid using my index finger, and then the lower eyelid downward using my thumb finger. And I'm going to apply the ointment from the inner to the outer canthus. Then I'm going to do it on the other eye. Okay. Then after that, we're going to place an ID band bearing the name of the baby and the mother on either side of the ankles of the baby. So assuming that we already done that, so we're now going to measure the baby's body length using this tape measure. So it is 52 centimeters. Now we're going to measure his head. centimeters. Now we're going to measure his chest. I'm going to lower it down. Thirty-three centimeters. Okay. So now we're going to take a baseline for temperature of the newborn as well as check for patency by inserting the tip of the NGT tube into the anus while positioning the baby appropriately. So 36 degrees Celsius. Then after that, we're going to put a clean linen on the weighing scale so that we can take the weight of the baby. So assuming that we already done that, the weight of the baby is 2.5 kilograms. Now we're going to do a thorough physical examination. Assuming we already done that, we will now inject the vitamin K intramuscularly on the left vastus lateralis. And then pinch. Then insert, support, retract, and then push. Okay. Then after that, we're now going to inject the Hepa B on the right vastus lateralis. Pinch, insert, support, retract, and then push. Okay, after that, we will now put on the baby's clothes, starting from the bonnet. Then the mittens. And then diaper. And then his shirt. then his pants. Lastly, the socks. Then after that, we're going to wrap the baby. Then after that, do an aftercare on the equipments and materials. That's all. Thank you.